I want here to direct your attention to an irony that this type of standardized learning has become a necessity only when machine learning entered the equation. It's as if we needed robots to remind us that humans are in need of more standardized learning algorithm.
That's a really thought-provoking point you raise. It does seem counterintuitive on the surface, doesn't it, that this detailed level of analysis might initially be driven by the needs of machine learning.
It's like we needed a new lens, the AI perspective, to really push us to capture the nuances of surgical technique in a way that benefits everyone, eventually.
What's fascinating here, though, is that in the pursuit of creating data for machines, we're actually generating an incredibly rich resource for human learning about those critical surgical trajectories.
Right, the detailed annotations we are talking about, marking special structures as they are approached, noting the angles, the intimate movements, that's gold for surgeons wanting to master a technique.
Exactly. Think about how those annotations can pinpoint critical and specific trajectory, highlighting key decision points, details a surgeon might not have time to verbalize during the procedure.
So it's about highlighting the rationale behind the trajectory, those silent moments of decision-making now made visible and analyzable.
Deep context about the why of the how. It makes the video actively teach the art of surgical navigation, you could say, not just passively show the steps.
And the PubMed article title mentioned machine learning, but the detailed datasets created are clearly beneficial for human learning too.
Absolutely. The article points out that these detailed labels, the annotations, create data sets, rich data that humans can learn from, including optimal and less optimal trajectories.
Learn what about the trajectory, though? What insights could a surgeon glean from these annotated paths?
Learn to recognize patterns and expert movements, maybe identify efficient and safe routes, spot critical moments along a specific path. It's like having experts breaking down their decision making.
Wow. Okay, so you're essentially making the videos searchable and analyzable for the nuances of surgical technique and approach, those unspoken aspects of trajectory, for human learners.
You got it. Go for it.
I think this is the time when we should include the surgical landmarks in our discussion. It is of utmost importance for the surgeon and the machine to be able to recognize these specific anatomical landmarks along the road. And I think that this process is already in use in automated cars. Safety and efficiency depend on visual recognition of these milestones.
That's a fantastic point. You're absolutely right to emphasize those key anatomical landmarks along the trajectory. They are crucial for both human surgeons and the machines we're training.
It's like having a mental roadmap, isn't it? Knowing exactly where you are in relation to critical structures at every stage of the procedure.
Precisely. And these annotated videos, by highlighting those milestones, reinforce that crucial spatial awareness for learners.
This really brings home that idea of democratizing knowledge about the best and safest surgical paths.
This is huge, and it speaks directly to the need I highlighted about the trajectory and those anatomical points. This is where that democratizing knowledge idea really comes alive. Like having an expert virtually guiding someone through the ultimate way to proceed.
Almost exactly like that. On-demand expertise, specifically about those critical but often unspoken aspects of the surgical path and its landmarks.
And this is where that incredibly detailed brain atlas becomes so valuable. Annotations can pinpoint the precise anatomy, those milestones along that route.
Precisely. Take a neurosurgery video, annotations can identify specific structures, the important anatomical points a surgeon is aiming for or avoiding.
So you're linking the visual in the surgery to the detailed anatomical map, showing the critical landmarks along the surgeon's intended path and focus.
Yes, highlighting those key structures, the milestones that define a safe and effective surgical corridor as they appear in the video.
It's like merging the live surgical view with a dynamic, path-focused anatomy lesson, emphasizing the critical landmarks.
That's a great way to put it, directly addressing the importance of those anatomical milestones along the trajectory.